Dr. Rawat sir is a senior professor of pediatrics and he was the former dean of Sagar Medical College in Madhya Pradesh. Sir is currently the national president of Pediatric Association of India. He is also the chairperson of the PAN Society and he is the joint national convener of IAP ALS BLS course. Sir is also a very good athlete. He had played hockey and still continues to play badminton. And he would be the most apt person to give the lecture on this. With this, I welcome you, sir, to deliver your speech.
Thank you very much. First of all, it is a wonderful venue and August gathering. I am really thankful to the organizers, Dr. Ashok, Dr. Devras, Dr. Sahu, and entire team of the Chhattisgarh Academy of Pediatrics to give me this opportunity to speak in front of my mentor, Dr. Chaudhary, and all of you. Dear friends, I think we should spend some time. We are taking care of the young children and we are counseling them, but what about ourselves? In fact, I was planning to talk on IAP guidelines on junk food in this conference. But then Dr. Anup suggested and Dr. Ashok agreed to it that I should rather talk on this topic. So this topic is there in front of you. Every person has an athlete hidden within himself or herself. This is a rock, but we can see that artist has worked on it to create a beautiful statue. For us to create an athlete, the artist is with us only, we are only the artist. It's really very good audio-visual arrangements, except there are some unsolicited auditory messages coming from the right side. I hope they will subside with some time. Now I will discuss what? The physical activity, exercise, types of exercise, overall health and well-being. And we all know, so I will not touch on this topic of the problems of the sedentary life. Wanting to sit and rest, our genes are like this. Our ancestors in the pre-agriculture era, they had plenty of leisure time, which we are lacking. They only got up, start moving when they are hungry in search of food. Otherwise, they were having all plenty of leisure time with them, actually. So our genes are like that, actually. So we want to take rest and do nothing. But now things have changed, so we have to also move ourselves. Sedentary lifestyle is the new norm. We have all the effort-saving machines leading to a very dangerous condition, that is sarcopenia. Sarcopenia is the loss of the muscle tissues. And gradually with aging, sarcopenia is likely to occur if we don't take some active steps to prevent sarcopenia. And sarcopenia is not only of the skeletal muscles. When there is sarcopenia, there will be sarcopenia of the cardiac muscles also. So good health, we all know, it depends upon genes, it depends upon society, the environment and the environmental conditions, the facilities in the society, in the community, but most important, the individual lifestyle, that is the physical activity and the food we eat. That is in our control. Genes not in our control, and community and society is also partially in our control. So what is the definition of health? You all know it is physical, social, mental, well-being, everything. So many things are there. But add one new dimension to health, that one should spend minimum daily recommended energy should be spent on physical activities. Unless we do that on daily basis, that our health is, definition fulfilling is partial, it is not complete. I am repeating, minimum daily expenditure of the energy should be on the physical activities. How much? How much we should spend on the physical activities every day? Now, suppose you are taking 3,000 calories, 2,500 calories every day, How many of this should be spent on physical activity? One third is very good. That will be very superior. But at least 20% energy is spent on this. Good. At least 20% should be spent on physical activity. Now this is the level of activity we can see now. We can see here that if we are spending 1500 to 2000 calories, this is weekly actually, this is very good. But we should aim for it. 3000 calories, that means 350 calories every day, this is excellent. We should try to reach at least to this level, at least very good level. For this is for all ages and for all ages. And this is the calorie cost of various physical activities. I will not go, you can see them anywhere, they are available. What is the calorie cost of various physical activities? This is important, we have to focus on, if we are physically active, the capacity of heart increases proportionately. Now we can see, at rest, this is the heart rate, this is cardiac output. So the cardiac output at rest is 5 liters per minute. This is for the athlete also. But when the all-out efforts are there, maximum physical activity, then a sedentary lifestyle, the cardiac output reaches hardly 20 liters. But the athlete hearts, the cardiac output may reach up to 30 to 35 liters. That is only possible with physical training. So we should try to achieve this. This is the another scoring of how to find out the physical fitness, level of physical fitness. So depending upon the distance covered in 12 minutes. If we can cover a distance of 2 to 2.5 kilometers in 12 minutes, then this is very good. Usually in, so this is very fast. So how much distance usually we cover in 10 minutes? 1 kilometer is covered in how much time? 10 minutes. So that means we have to move little more faster. Move out of the comfort zone. You start moving, anybody will travel 1 kilometer in 10 minutes, gradually increase the speed. If we don't move, try to keep on moving out of comfort zone, improvement will be static. Okay, so this is very good. That's why it is very good. Otherwise 1.5 to 2 kilometer is good. So we are in this range actually. We are in fair range. So we have to gradually increase this. We can and we can. This is second wind actually. When we start doing any physical activity, maybe walking or jogging, we become breathless. But if the same activity is continued for some time, then we become again start breathing comfortably. That is known as the second wind. And trained athletes can go up to third wind, fourth wind. Marathoners go up to seventh wind. They again and again become uncomfortable in breathing, and gradually they become again comfortable. So we can keep on getting the second wind, third wind, and like that. Gradually increase. But now these are the various physical activities. What they will do actually, they will build the strength, they will help in improving the flexibility, the endurance, that is aerobic capacity or cardiopulmonary fitness, the speed, and they will improve the skill also. Even walking also is a skill, so jogging is also a skill, so they will gradually improve the skill, and there is a reduced risk of depression, anxiety, loneliness, and better focus, better sleep, and also for children better school performance also. Physical activity and exercise, what is the difference? Good morning, sir. Welcome, Dr. Dapke, sir. So whatever we do, that is a physical activity. But when we have a well-defined objective, what we want to achieve with this physical activity, then this becomes exercise. So all physical activities are not exercise, because exercise will have a definite objective. Objective may be improving aerobic capacity, objective may be improving your strength, objective may be to reduce the weight, to bring back the weight to the normal. So that will be objective. So exercises with an objective. Without objective, this is simply physical activity. Now these are the various physical forms of the exercises. One is aerobic. Aerobic will do what? They will improve the endurance and stamina, the cardiopulmonary fitness. Second is flexibility. This will improve the range of movements and this will help to prevent the injuries also. So flexibility. Third is strength. This will give us power and this will also prevent the injuries. And strength training will also make the bones stronger. And speed and skills for the sports and breathing exercises. So these are the various forms of exercises or physical activities, and we should try to combine them. Flexibility training, stretching exercises. They may be in the form of yogas, various yogasanas, and this can be dynamic stretching also, that is aerobic dance also. So stretching, and they should be done every day, few minutes. So flexibility will be improved and that will increase the range of movements and that will prevent the risk of injuries also. Aerobic training. Aerobic training simply ability to work hard, fast and to recover from strenuous exertion quickly. Cardiovascular fitness. Usually in aerobic activities, large muscle groups are used and during activity, whatever oxygen is required, that is also supplied. So there is no deficiency of oxygen. That's why they are known as aerobic. There is no oxygen depth also in this. They can be continued for a long period of time. We can walk for hours together. Now the various forms of aerobic activities are brisk walking, jogging, swimming, biking, aerobic dance. These are the examples of aerobic activities. They will improve our cardiopulmonary fitness, aerobic capacity. Okay. In aerobic, the heart rate increases substantially and they should be done for any activity we are doing. Some aerobic activity of 5 minutes should be done as a warm-up to improve the circulation of all the parts of the muscles and the body. In the aerobic activity, depending upon the objective, we have to decide the intensity, duration and frequency. The maximum heart rate one should try to achieve in aerobic activity is 220 minus age. So if my age is, suppose anybody's age, not my, anybody's age is 20 years, so it should be 200. That during aerobic activity, heart rate should reach 200. 200 will be 100%. So we should try to aim 60 to 80% of the maximum heart rate. Okay. Then there should be cooling down also. Cooling down will help to remove the lactic acid and next day we will be comfortable. And then strength training. Strength training will prevent sarcopenia. This is very important. It will help to improve the tone, strength. Now these are the various forms of strength training, weight training. Progressive resistance in a series. Calisthenics can be used as for weight training, strength training. Calisthenics means using our own body weight for the training. You can use simple push-ups, chin-ups, sit-ups, and kettlebell is another very good thing. I think some of you might have used or seen the kettlebells. They are simple to, we had dumbbells actually, and dumbbell in place of dumbbell, now they are kettlebells also. They can be used, therabands are there. They will all help to improve the muscle strength. Speed training to move out of comfort zone. Whatever we are doing, try to do the same thing in less time so that there is some anaerobic conditioning also there. And choose a combination. So make an exercise plan in which there is a flexibility, there is aerobic, there is strength training, there is also speed and skills also improvement there. So make a plan for all this. Gym, usually people don't find time for the gyms. They enroll in a gym, pay some advance, go for 2-3 days, stop going. Alternative is make a home gym. simply calisthenics, kettlebells, therabands, resistance band, and you can use your own home gym. You can use it at your convenience anytime, 24 hours in a day. Food and nutrition, the only problem with today's is that we have taking more of the energy rich food. Our food has become very energy rich. It has become nutrients depleted food. So we should now focus on energy rich food. Sorry, we should focus on nutrient rich food. Fast food, junk foods are new epidemic we are facing nowadays, today, children and we also. So balanced diet means home cooked food, taking natural things, trying to eat fruits more, fresh vegetables, try to avoid the fast. Our festivals are such that we buy sweets, we distribute sweets. And that way we are making a unhealthy food choices. All religious activities, sweets must be there. Though the offerings, he will only see, the Almighty only sees what you are offering, he will not eat. We only consume, so for whom it is. So my suggestion is when you have to some puja, some religious activities, don't buy 5 kg of the sweets. You can offer him 50 grams and 100 grams also, he will be happy. These sweets are to taste actually. Sweets are for the all things, ice creams, all those things, cakes, everything. They are for the taste. So taste them, but don't eat them. And the taste remains the same when you eat 10 grams, 50 grams or 250 grams. So for taste, a small amount is required. All these things I will skip, and you all know this, but only thing, as in the one of the previous speakers said, that whatever you preach, practice it on yourself. Don't simply preach, practice also. The weight, we are worried about the weight. So what is the ideal weight actually? Ideal weight is when whatever your weight at the age of 18 years, but now we cannot see that also because adolescents, young children are also getting overweight. School children, 5 in 1 are overweight nowadays. Adolescents, 4 in 1 are overweight. And this continues, so the obesity may be 1:1. The only way to reduce it is what? If you want to reduce it, either stop doing the NFHS survey, NFHS survey ही बंद कर दो आप, या फिर फास्ट फूड जंक फूड्स आपको बंद करना पड़ेंगे. So all this we know, but the simple is, this I found very useful, waist to height ratio. The waist should not be more than 50% of the height. So those who want to do it, they can, I think Dr. Ashok will provide the measuring tapes also, and the height and the waist, please. Keep it, the waist should not be 50% of the height. Always try to take some inconvenience, move out of comfort zone. Good pair of shoes. The most important part of our dress up should be the shoes. Not because the feet arches are not developed. They have been very good. But they have been always they have been protected from all sides, so they have become weak. So now we want a good pair of shoes is important. Glycemic index, whatever is increases our blood sugar will cause release of insulin. Insulin will deposit this glucose in the fat, and again there will be rebound hypoglycemia. So we want to meet again. The cycle goes on, and the fat is the stored form of energy which is seldom used when we need it. This we have discussed. See, what we can see here, the skeletal muscles have a basal metabolic rate about 15%, and the adipose tissue has only 5%. That means what? If we have more of the muscle mass, our basal metabolic rate will be high, and when we are resting also, our energy expenditure will be good. $200 calories per day extra will convert into 9 kg weight at the end of 1 year. This is too much of. I will skip all this. I will leave 1.5 minutes for any questions there, any questions which you may have. But make a balance of what the exercises. Is aerobic, yes.
Chief.
If any person who is doing exercises for whole of the day, but not of that intensity or that of the stamina, so he must be also getting advantage of that.
Advantage is there. See, suppose you have less time. Aerobic activity, you cannot walk for hours together. You are a busy person like Kiran, so nobody can spare time for hours of walking. Then the same benefit can be achieved in 20 minutes of aerobic activity, provided that we are able to increase our heart rate about 60 to 80% of the target heart rate. So in 20 minutes, the same benefits of walking for 1.5 to 2 hours.
Sir, there are a lot of things and a lot of senior pediatricians. Somebody is on beta blockers. Beta blockers, you do not get that 80% of the 20 minus age target. There are some who are on statins which are very much injurious to muscle and they cause a lot of muscle aches. So these are the problems. And suppose somebody induced by your lecture wants to carve out an athlete within from tomorrow, should he be going for some pre-tests with a
Certainly,
physician or something?
certainly. Always consult your physician first and always start very slowly and gradually. Suppose totally you have been not walking, somebody is not walking at all, start 10 minutes jogging. Then increase to 12 minutes. Every day increase 1 minute. Then you are comfortable, you reach 60 minutes of jogging. Don't increase the speed. After 60 minutes, now you increase speed slowly and slowly. So build up gradually. But muscle strength training exercises should also be done simultaneously. Walking alone will not build up strength in the muscles. They will improve the aerobic capacity only. But start gradually. Take care of all your health and take help of your physician also. Very important. But probably if those who are not on the beta blockers and those who are not taking statins, if they start, they will never need probably beta blockers in statins. Maybe. Thank you very much. But choose a sport or something like which is entertaining also, and there is a component of light component of competition also. You have to perform. Best competition is on the sports ground actually. So you should try to do better than what else is doing. Thank you very much. Such a wonderful audience, patient listening. So nice of you. Thank you very much.
Thank you, sir, for excellent talk. With this, we close the session. Thank you.